So we'll get started. These are just my disclosures, and there's none relevant for this talk, other than I am doing some clinical trials involving genetic forms of frontotemporal dementia and Alzheimer's disease, which are both young onset dementias. So everyone can see my presentation view and everything is good then. So, yeah. Okay. So I'm going to be talking about early onset dementia. Thanks once again for the opportunity to speak to you again today. I recently presented this at a local ECHO series here in Toronto, but I think this is kind of a broader community. So I'm going to be talking to you about the approach to the differential diagnosis of young onset dementias using clinical, cognitive, and neuroimaging investigations. I'm going to be talking about important diagnostic considerations and related investigations not to miss in the workup. And I'll also be talking about kind of specialized testing, including genetic and neurometabolic laboratory investigations. Now, this talk is, we will go into some details, but I think the most important things to kind of raise is, from your perspective, as I think you see more of the elderly patients, but keeping in mind that you may come across younger onset cases in the community where you're working, especially if you're in underserviced areas. They may come to your clinic as opposed to someone else's clinic. And I know individuals from the psychiatric background will also see a lot of cases of young onset dementia as well. So I'm going to be giving you, this is what the background is. I'll be talking a little bit about why young onset dementias are important and why they're different from